Good afternoon, everyone, and thank you all for joining us today. My name is Brendan McMullen. I'm a first-year student here at SAIS and the coordinator for this year's International Development Roundtable Speaker Series. The Development Roundtable is a high-profile speaker series where leaders and scholars within the international development sphere address our community on trends and challenges that are shaping the field. Before we get started, I would like to go over some of the basics of today's event. The event will be recorded and the chat feature will be disabled. However, if you have questions, and we hope that you do, please feel free to type into the Q&A feature at any time throughout the event. When submitting your questions, please indicate your organization you are from, just as you would if this were an in-person session. Today, our virtual webinar is with an esteemed guest, Dr. Marie Ruel, the Director of the Poverty, Health, and Nutrition Division at the International Food Policy Research Institute. Marie brings nearly 30 years of poverty alleviation, food insecurity, and malnutrition policy and programming experience to her current role as director. In 2019, she won the American Society for Nutrition Kellogg Award for Lifetime Achievement. Today, Marie will be discussing the coronavirus pandemic and global nutrition and offering key protection strategies for the world's most vulnerable. Also on today's panel, we're privileged to have Dr. Jess Fonzo, who will respond to Marie's presentation and be available for Q&A. Jess is a distinguished professor of global food policy and ethics at the Berman Institute of Bioethics, the Bloomberg School of Public Health, and SAIS. So with that, and without further ado, I will now hand it over to Marie, who will give her presentation that we're all waiting for. Thank you.
Hi, everyone. I'm going to share my screen now. Hi, so thank you very much, Brendan, and thanks for inviting me to give this lecture. Of course, it was supposed to be an in-person lecture in the spring this year. And of course, here we are with another webinar. But it's a real pleasure for me to be here and to talk with you about the pandemic and its impacts on nutrition and what we can and should do in order to prevent real damage in nutrition. So as many have noted, the COVID-19 pandemic has all of the making of a perfect storm for nutrition. We expect impacts on all forms of nutrition, from child wasting to stunting to micronutrient deficiencies at all ages, and to overweight and obesity in many contexts. This is likely to put us off track and reverse the gains we have made over the past decades in improving nutrition. You can see here where we were a few months ago in terms of the burden of childhood malnutrition. 144 children were stunted. That means short for age. 47 were wasted, meaning they were thin, and up to 38 million were overweight. And we can see on the right side here that we have made a lot of progress in reducing stunting over the past 2 decades. And this is what we are currently concerned of losing. We still have 47 million children that are suffering from wasting, and we don't have the trends over time. This is a number that has stayed relatively constant, and overweight was increasing already. And of course, the biggest burden is in Asia and Africa, where most of the bulk of malnutrition is happening in all its forms. We also have 2 billion people with micronutrient deficiencies and 2 billion adults with overweight and obesity. So this is a very big burden. And why it matters is because malnutrition is associated with 45% of all child deaths, largely due to infection. And the long-term consequences for those who survive exist affect their health, their cognition, intellectual development, their schooling, and their economic productivity, with largely irreversible damage. So we need to pay attention, of course, and COVID is likely to have a major impact on nutrition. And the reason why nutrition is so vulnerable in the times of COVID is because The pandemic and related economic crisis and food systems disruptions affect all of the systems that we rely on to improve nutrition. So this is what I will try to summarize for you pretty quickly today. What is happening to these systems that we have here: health, social protection, food systems, water and sanitation, and hygiene, and how that is likely to affect different forms of malnutrition. So starting with health systems, which of course are the systems that we use the most for delivering our essential nutrition and health interventions, also for the routine prevention and treatment of infections and severe acute malnutrition. And we have found that, of course, there are major disruptions. We have all heard about those, and it's been difficult to track what they look like, what the disruptions really look like in different countries. But WHO has been, among others, has been tracking and saw that there were, and the data are probably already a bit old because they're not able to update them very regularly, but there's more than 50 countries that showed major disruptions in antenatal care, in immunization, and in management of moderate acute malnutrition and severe acute malnutrition. So with reductions in antenatal care, we can imagine problems with childbirth also, and with pregnancies and childbirth. Immunization will lead to a lack of immunization, or reductions in immunization will lead to infections and a much higher risk of mortality among children, also with the interruption of the management of severe acute malnutrition programs. There's also disruptions in the stocks of essential drugs, of micronutrient supplements, micronutrient fortified, ready-to-use therapeutic food, which are the treatment for severe acute malnutrition. And if there are stockouts of these products, again, we have a real risk of increasing disproportionately the children that are suffering from SAM or MAM. We also have disruptions in the demand for services, especially at the beginning of the pandemic. We have heard that a lot of people were not frequenting the services because of fear, lack of transport, income losses. They didn't have the money to even take transport if it was available. So there's been really a disruption both from the demand and the supply side, and it does look like things are settling. Programs, health systems are adapting, are innovating. There are improvements, but before we get back to normal will take quite some time and a lot of creativity. So we are concerned about maternal and child undernutrition, increased infections, as well as micronutrient deficiencies, and of course mortality. In terms of the economic crisis and the food systems, our economists at IFPRI that work on macro modeling using a model called Miragrodep have estimated about a 4.8% global economic downturn. This is expected to lead to an increase in 95 million of additional people falling into extreme poverty, 13% of the population in the world. And we can see differences by region and by urban rural areas, with some groups being more vulnerable. And in terms of changes in consumption, which their models also generate, it's global, it's not specific to any country, it's really a worldwide assessment of the changes in food consumption. And we can see that the bars in red, especially on the right-hand side, show that there is a significant reduction in consumption of fruit and vegetables and of all types of animal source foods. This is not surprising because, of course, people have, in large part, have lost their income, or a large proportion of their income. They've lost their jobs, or they work less hours, and they have to protect the food security of their household. And for them, this means preventing hunger, focusing on calories, and letting go of the foods that are more expensive per unit of calorie. And so they tend to shift to diets that are richer in staple foods and grains, and other sources of calories like oil, etc. So another aspect I wanted to mention, I will not talk about this more in this presentation, but we know that the crisis, and many people have said that the crisis is really exacerbating inequalities and makes it, puts the spotlight on how much inequalities we have in the world and how those have not been dealt with. And the people that are suffering the most right now are those that are poorer, maybe women, maybe those living in certain areas of the country that have less access to services, etc. And so here's an example from some phone surveys done by IFPRI in Addis Ababa that shows that the income declines, for example, were greater among the poorest than among the middle and richest households. 50% of the poor had lost their income and compared to 26%. In consumption of dairy, this was also, they analyzed the dairy value chain, and they show that the reductions in consumption of dairy was larger, again, for the poorest than for the poorest and the middle income groups than the high economic group. And this is no surprise. Again, the high economic group can afford to purchase these products, even if they may be more expensive per calorie, because they are looking for diversity and they can afford it. But that's just one point I wanted to make sure that we understand how much the vulnerabilities and the inequalities are highlighted, exacerbated by COVID. We have some other results from our phone surveys. What we realize is how quickly the situation is going. There, some of the results that I have here from phone surveys in Ethiopia, Myanmar, and Bangladesh, for example, are already out of date. But they had shown at the beginning really that there was up to 80% of households that were reporting drops in income. 25% or so was the average drop in the amount for food expenditure, how much they spent on food expenditure. And many were using coping strategies such as reducing the number of meals per day and reducing nutritious foods, as I've mentioned before. So the coping strategies were really a sign of distress. They were using extreme coping strategies and those that were related to their very high level of food insecurity. Now, in terms of food supply chain disruptions, again, we saw at the beginning a lot of disruptions, both in demand and in supply. Among other things, in Ethiopia and other countries around the world, there was this belief that animal source foods were responsible for the transmission of the virus, and therefore people avoided them. An additional reason, on top of the fact that they were more expensive. But in Ethiopia, 50% of them avoided them, and there was definitely misinformation. They did believe that the animal source foods were part of the problem for transmission of the virus. And there was a lot of, here we had an analysis in Ethiopia of the supply chain for vegetables, which was a typical value chain of perishable food that are fragile and that were affected at all levels of the supply chain, from not so much the production, but certainly from transport to transformation and retail. Lots of waste of the vegetables because farmers just did not have the same demand and didn't have a place to sell their crops. So as I said, this was more at the beginning, and now what we hear from more recent research is that the food supply chains are stabilizing, and we can hope that in 2021 and 2022, there will be less volatility in prices and hopefully less volatility in prices of nutrient-rich foods. But given the situation, we can still be very concerned about the deterioration of diet quality and micronutrient deficiencies, particularly from the loss, excuse me, of livelihood and income. Now, what has been done about this in several countries is to work with social protection programs. Countries have adapted, expanded, modified the delivery of their social protection programs. The World Bank is tracking the response of countries in terms of social protection programs, and they reported that up to 170 countries, and this was in July, I think the latest update, had done that, had some ongoing social protection programs that had been modified and adapted, and that provided mostly cash or food transfers. And again, if we think of the food transfers, they're mostly non-perishable staple foods, oil, and these kinds of products rather than nutrient-rich foods. School feeding programs were in the same situation. In the spring, there were 370 million children without school meals. And at the time, about 70 countries had implemented take-home school meals or cash transfers. I haven't seen updated on those numbers, but there was really an effort to use social protection as one way to protect the population and to protect their food security. But we feel that it's certainly unlikely that the programs will be able to meet the demand on social protection and on school feeding programs. And for the school meals, we have concerns about the quality, the diversity, and the micronutrient content of the meals that they provide. Again, that may not be rich in micronutrients, and that may be focused mainly on keeping calories up with staple cereal and starchy vegetables. Water and sanitation is also extremely important. This is not an area that I work on directly, but I wanted to call our attention to the call to action that has been released for water and sanitation and hand hygiene as the first line of defense for COVID, and the large inequalities in availability, access, and utilization that we see in this area, especially in urban areas, but also in rural areas where people don't even have access to potable water. And so this is also something that will increase infections in young children, for example, and will result in more malnutrition. So the second part of my presentation is to report on some of the results of some work that we have done with the Standing Together for Nutrition Coalition, which is a group of researchers in a variety of disciplines that has a mission of connecting and building evidence for nutrition action in the context of COVID. So it's a newly created group that is working hard and trying to do some advocacy through providing some research and information on estimates of the magnitude of the burden of COVID on malnutrition. So here is the first slide that I wanted to show on that, which is work that was done by Tim Robertson from Johns Hopkins using the LIST model, Lives Saved model, that Hopkins has developed and has used extensively in countries with governments to highlight what they can do to improve nutrition and to improve reduce mortality by scaling up certain interventions and deciding which interventions matter most for their own condition based on this modeling tool. Now, Tim used this modeling tool to go the other way around, look at what could be the impacts of reducing the coverage, of reduced coverage for certain health and nutrition interventions. There's about 80 interventions in this model. And so this paper took three scenarios of hypothetical reductions in coverage and hypothetical reductions in wasting as well, and assess the impact on malnutrition. I won't provide the results of those. I will move on to what we did. So what we found was that this was really shocking. The result that it had was a lot of additional mortality, child mortality expected in 2020 from that modeling. But what we thought was missing was that this model was just focusing on the health effects. And as I've mentioned before, there's a lot of other effects of the crisis that will have impacts on malnutrition and on child mortality. So we joined forces again with our macro modelers at IFPRI, using who use a Miragro-DEP model. And we asked them what indicator could we include in the list model that would help us capture the effects of economic and food systems crises, the fact that people are losing their jobs, their income, their food security, their diet quality, etc. And that would be one indicator that we could model in order to assess the impacts that that would have on child malnutrition. So they selected for us, they recommended the gross national income per capita indicator, which comes from those models that I have mentioned in one of the first slides that predict the increase in poverty and changes in consumption. So from there, we needed to know what was the association or the coefficient we could use to predict the changes in wasting from the GNI per capita changes, variations from the shocks that we see. And so this used an analysis of about 171 DHS surveys that Derek Heady has put together, and he carried out the analysis. And so we had now a coefficient to include in the list model in addition to the GNI per capita. So we could now predict the impact of the health system shocks, as well as the economic and food supply shocks, food system shocks on wasting. And we could then include all of this in the model and predict impacts on mortality. So here are the results, and these have been published in July. There is one paper that summarizes the approach and the results, and one short commentary that is a call for action signed for UN Director General. And so the results showed that we expect in 2020 to see an increase in child wasting of 14.3%, which corresponds to 6.7 million additional children with wasting this year compared to no COVID projections, and which is mainly to be found in Africa and Asia. 80% of these would be in Africa and Asia. And for child mortality, the expectation is an additional 128,605 deaths, about 10,000 more deaths per month. So this is what we have now published, but since then the team has continued very actively to work on using this model and other tools to look at impacts on child stunting, to look at birth outcomes, and to look at maternal BMI and anemia. So we are looking at different types of impact on mother and child. And we're also looking at estimated impacts all the way to 2022, 21 and 22. So this is a great expansion of our work into the next 2 years. And as I've said before, things are expected to change in terms of the more stability of the food supply and chains and of the food systems. But the expectation from the economic modeling is that 2021 and 2022 will continue to have a severe economic recession. So we will have high numbers of expected children, additional children with malnutrition, mortality, etc. in these years as well. So how to protect? This is a busy slide because, as I've mentioned at the beginning, we're relying on all of those systems to improve nutrition, so they all have to contribute to the solution. And so in terms of health, and I will go fast on the recommendations and we can discuss during the discussion. So on health, of course, we wrote those papers, or we made sure to have estimates of the impacts on nutrition early on, because we wanted to make sure that nutrition services were not forgotten in routine child health services, for example. So we wanted to prevent the collapse of those services in particular. We recommend, of course, to promote and support and document innovation in service delivery and outreach. We know there is a lot going on in the countries. They are adapting, they are restoring, they are making incredible use of their resources and being creative on innovation. but we need to document those initiatives as well if we want to share and be more resilient in the future. We need to prepare for rises in wasting. I feel that wasting, the MAM and CMAM, or the CMAM, the services, the typical services that exist in countries to treat severe acute malnutrition at the household level, are one of the services that are the least well functioning. They are not used very much by the population. There's a lot of children that are missed by the CMAM services. And so we need to not only fix those, but make them even more prepared for the increase in wasting that will happen. And we need to ramp up, of course, the prevention of malnutrition. So the health system has a lot to do, and I know they are very active. In terms of social protection, well, continue to expand, scale up, and develop new social safety nets. And again, with innovation in implementation modalities and delivery of systems. And we see that, for example, in India, they're delivering the food at home, but of course that affects the kind of food they can deliver and they can distribute. We need those systems, those social protection systems, to also try to focus more on diet quality, not just on quantity, especially school meals. We can think of vouchers for nutritious foods. This is urgent because the crisis is here to stay, and we need to have social protection programs that don't just provide cash without education or just staple foods. Support homestead, local food production where available, where relevant, to increase access to nutrient-rich foods, fruits, vegetables, eggs, chicken. Those can really make a difference in these times of crisis for food security and access to affordable, nutrient-rich foods. In terms of food systems, I will be brief here, even briefer. The first thing I heard at the beginning of the crisis from Maximo Torero from FAO when he talked about the impacts on the food systems, he said the one thing we need to do is to keep agri-food systems functioning. And that is still the goal, the main goal. We need to have the producers produce and the traders trade, and the people that do the transformation and sell in retail. And this, as I said, has improved, but there's still quite a bit of a way to go to make sure that there are not new waves of losses of labor and losses of crops and disruptions in the food systems. We need the food prices to remain stable, and we need to improve access of poor populations to nutrient-rich foods. We need to also stimulate the demand. It's not enough to just provide those foods and make them available in markets. They have to be purchased, and people have to have more information about why they should eat more of those nutrient-rich foods. We need to invest in providing access to WASH for everyone. And finally, very importantly, we need to address the vulnerabilities and inequalities. And there are many, and as I mentioned, I don't have time to talk about those today. But in conclusion, nutrition is definitely a multi-sectoral problem that does require multi-sectoral solutions. And here we are in the middle of a crisis, and this statement that we've had for a long time could not be more relevant. Thank you.
Thank you so much, Marie, for that incredibly informative presentation. We'll now go over to Jess to respond briefly, and then we're going to jump into Q&A. Just a quick reminder, please indicate your organization that you are from when you're typing your questions into the Q&A feature. Thank you.
Great. Thank you, Marie, for a fantastic whirlwind talk on the importance of nutrition in the time of COVID. And I'm so pleased to see so many people have joined. We had about 80 people joining, so it shows the importance of the topic and also Marie's leadership in this whole space. So really thank you for coming to SAIS and spending the hour with us. And yet your talk, it's daunting of, you know, the impacts as well as all of the buttons that need to be pressed across multiple systems. I've read the wasting paper that you all published in Lancet, but when you see the numbers, it's actually quite shocking. So I came away with really three or four things that I hope that you could discuss, or more questions than anything else. So I think you really nicely show that the integration of systems is so critical if we're going to address the burden of malnutrition that we had before the pandemic, and that is escalating now with the pandemic. And it leaves me thinking, you know, in times now with some of the geopolitical strifes that we're facing, how do governments prioritize? If they know that they need to engage food systems, health and nutrition systems, social protection, et cetera, in the constraints that we're dealing with, how should governments think about prioritizing? What would you recommend to the government of Ethiopia or Bangladesh on what should absolutely come first? That was a question that was in my mind. A second question is this wasting issue. I mean, you had indicated 6.7 million more children will become wasted. It's just astonishing. And I guess a question about that analysis, maybe thinking about the future work you're doing to look at stunting and body mass index and other outcomes. What kind of scenarios were you all looking at? And how do you kind of deal with the unknown scenarios? It's so hard with COVID to know where we are. You know, when is it going to end? Is it going to get worse? And so how, when you're taking into account these models and just in general, how do we deal with those unknowns? So it'd be good to learn a bit more about the models that you used, and how those, could those numbers get worse if COVID continues to worsen as it is around the world. The third thing I was thinking about, and this goes a bit to your work, Marie, you were critical in a lot of the early work understanding the long-term consequences of malnutrition and how it can have lifelong ramifications that are costly for an individual, costly for countries. And you did a lot of that work in Guatemala showing those lifelong consequences of having being born undernourished and continue to be undernourished and potentially overweight and obesity. So what are, you know, maybe from a personal perspective, what are some of your greatest fears with COVID in the impacts and long-term consequences for malnutrition? You know, you've been modeling some of the effects in the now term, but what do you think 10, 20 years down the road if no action's taken? And then last was more around food prices. You know, you had discussed the stability, the importance of stable food prices, and the Food and Agriculture Organization's State of Food Insecurity report really showed that so many people can't get access to a nutritious diet. It's just out of reach. It's unaffordable. And now with COVID, it's just, I'm assuming, worsening. So what kind of immediate actions could governments take to try to stabilize food prices, particularly for those more nutritious foods? So that's what I was thinking. I was hoping you could shed light on. I'm sure we've got tons of other questions, so feel free to feel free to address what you want to. But thank you again for such a fantastic talk.
Okay, well, yeah, some are very broad questions. I'm not quite ready to talk to the minister of it, or whoever you asked me to talk to in Ethiopia. Let me start. How do we prioritize and all that? And you raised the issue of costing. And yeah, seriously, I just, if you ask me what to prioritize in nutrition, it would be easier. But you know, IFPRI does this modeling and has done that for a long time. This prioritization and this maximize, those models that maximize impact. And I remember my previous director, Schengen, had these results, specifically for Ethiopia, that were showing that to reduce poverty, you had to focus on roads, and health didn't matter. And all the other things didn't matter as much as focus on roads. And, you know, and I was just saying, well, sorry, this doesn't work for me, because you can't do just one thing. And for nutrition, you do, as you mentioned, and as I've insisted on, you do have to press all the buttons at the same time. So it's very hard to prioritize. One thing I didn't mention in the work that we're doing, coming back to nutrition per se, is that there is also a costing that we're doing in the context of the work of the Standing for Nutrition group. There's in the papers, there will be an estimate of how much it would cost. And there's also optimization using Optima, the modeling that that is done with the Optima tool by Nick in Australia. So anyway, I think the optimization, the results of the optimization you will find very interesting. That is basically for countries and globally, if we were to shift which programs to emphasize right now, that's what we would get greater reductions and greater impacts on reducing mortality. So those are very, very difficult questions. And as I said, for me now, I think the focus on wasting has been important, because in nutrition, we tend to not talk about wasting very much, because it's a smaller number of children, it's a lower prevalence, and it's a different group that has worked on wasting. It's the medical doctors, and we haven't had so much to do with wasting. And I thought for now, it was really important to focus on wasting and make sure that children don't die. And then we can deal with other things. But it's for me that's something. And I even I gave a talk in Mexico, not in Mexico, but to Mexico recently, where they're not thinking of wasting. They have some wasting, but it's isolated and in its pockets. And so they're basically completely ignoring the fact that they may be seeing real increases in wasting in their country, and they don't have necessarily the means to address it. They have long moved on to stunting and obesity. That's what they're dealing with. One thing I also wanted to mention when you were asking your question is that in all of the estimate, well, how do I feel about all these numbers? And I know we will get, and we are getting some pushback from people saying, well, these results are not taking into account all the things the countries are doing. And it's very true. But we had to have a worst case scenario so that we would shake a little bit and make sure that this was an advocacy approach as well. And so it's true that we're not taking into account all of that, but the problem is that it's going to be so difficult to have data on what they're doing and on the impacts of what they're doing, because we can't be out there and collect data, and we can't do virtual anthropometry. I don't think it works yet. And, you know, so it's going to be difficult. And I know there are some efforts, all the phone surveys, we do that too. And I'm not satisfied with phone surveys. You know, you can spend only 20 minutes and you can ask little questions here, but it's not profound, it's not very detailed survey. So it will be very difficult to actually know what's happening and have data that we can believe in, and know if those projections were completely out there. You know, I don't know when we're going to figure that out. The long-term impacts, yes, I think that's a really important topic. In our projections on stunting, for example, we don't project that there will be more stunting necessarily this year, because it's a cumulative process. It will come in the years to come with the new kids that are born small and that are not going to grow as well as their potential is. And so I think those long-term consequences, especially on overweight, obesity, and susceptibility to risks of NCD, of non-communicable diseases, are going to be enormous, especially when this malnutrition happens during early childhood, and then these people become exposed to the nutrition transition, or a country that has a lot of the obesogenic environments. And finally, on the food prices and cost of healthy diet, this is something else indeed that we're also addressing the issue of the cost of healthy diets in our paper, following and working with Anna Hartford and others, following the work that has been done for Sophie. I think this work was absolutely fantastic. It was good to see that this issue is taken up by economists, and hearing Jeffrey Sachs that say we need another poverty line because nobody can afford the healthy diet with the poverty line we have. So it's just not a good poverty line, and so I think we've made a great progress there by just highlighting the issue of the cost of nutritious foods or healthy diets. I think this is changing people's views. This is changing in a lot of discourse. You hear a lot more than ever about healthy diets, and this report is responsible for that. It's a big flashy report, splashy report that comes out every year, and I think for this year they really came into the area that belongs to them, look at the cost of diets, and that's why people are malnourished, because they can't afford the healthy diet. I'm going to stop here.
Thank you so much, Marie, and thank you, Jess, for your questions.
Thank you.
We have quite a bit of questions in the Q&A feature. So there's a lot of common themes, one of which is the reliance on ready-to-use therapeutic food and for treating severe acute malnutrition and moderately acute, and the difference between local production and importing these. Can you speak a little bit on that and what is being done to change the food supply system?
Yeah, I don't have that information. I'm about to get on a committee to review all of the guidance on wasting and severe and acute malnutrition, and I think these things will be discussed. But right now, I'm not sure in terms of the efficacy, what has been demonstrated. It's not so much that, you know, our UTF needs to be imported as the question is. It would be good if it could be produced locally, definitely. But do we have efficacy studies that have shown that these products work equally well? And I think there's some studies, but not a lot. And so I don't think we have the answer yet, but certainly in these times, it's much better to think of a locally produced product and if possible, test it, but just try it, than wait and not have anything for those children.
Just going off that question, we have the question is, are UTF sufficient, and the impact of food aid? Is food aid being used to its maximum potential amid the pandemic? What advice do you have? Food aid is obviously not a long-term solution. So could you just speak a little bit on that?
Yeah. That's another thing I don't really know. For example, I have no idea what USAID is doing during the crisis. I haven't interacted on that very much. I'm sure they've had delays. I mean, there's been probably problems of transport of the food, and then problems of transport across the continents, but also within countries. I'm pretty sure that NGOs that implement these programs, these food assistance programs, have started a long time ago. But how fluid is the distribution right now? I really don't have the insight from any country. Food aid does work, but it has to be accompanied by behavior change communication and by education about using health services and all that. It's not enough to just distribute food. You have to educate the population and also make sure that they go to health services as required.
Going off on food aid, do you think there's going to be changing preferences of people donating or accepting food aid, and then challenging the sustainability of long-term food aid in the future?
I didn't hear everything. Sorry.
So we have a lot of questions on food aid, and
Okay.
it's changing preferences. So people preference to give and preference to receive amid challenging political environments, as well as the sustainability of food aid. How long can it last?
Yeah.
We also have food aid in a lot of hard to reach populations, vulnerable populations, whether they're in tribal or displaced people. So can you speak on food aid and addressing those who need it most?
Yeah. Well, we have done a recent study in the past, let's say 10 years. We did a 5-year study in Burundi, for example, a country where there is extreme malnutrition and as well as illiteracy and extreme poverty, really a terribly poor country. And we've shown with this study that a regular distribution of food aid combined, again, as I said, with as good as it could be behavior change communication that was done by illiterate mothers to illiterate mothers, and then some strengthening of health systems or at the same time. So that was the nature of this program. Really did have an impact, protective effect on many aspects of the household, not just on children's nutritional status. There was a protection in terms of reducing stunting and wasting, but also in terms of increasing the food security of these people and the availability of food. And the food that was distributed was fortified. So it does bring a lot of micronutrients that they don't have in their regular diet. So I think it is really important right now. And yeah, people have to, I will think people will accept it given the conditions in which they are.
We also have another good question from Darcy Williams from UNICEF. He's asking about the effect of the pandemic on overweight and obesity around the world as children are forced to live less active lives during the lockdown and have less active healthy food choices.
Yeah, I have the same question. I really have not seen data from, and I work only in low and middle income countries, but in countries where there is availability of ultra processed foods that are cheaper, that fill the stomach and all of that, I am really concerned that, especially in urban areas, but still there's quite a bit in rural areas as well. But I am wondering how we can possibly get data on those changes in populations that have access to these foods. And again, I don't know where to start to get this information. I will talk with people from Latin America that certainly are keeping an eye on that. I know that in Mexico, they're doing a survey right now in person, and they have phone surveys, and so they will be able to document that there. But there's not many countries that have ongoing surveys. It's a very good question, and I'm pretty sure that there will be, as was mentioned, not just a lower level of energy expenditure, but really the cheap fast foods, macaroni and cheese, etc., that just fill the stomachs and makes everybody happy. Oh, you're muted, Brandon.
Yes. We have another question about using the pandemic as an opportunity for future growth. The pandemic obviously is exacerbating a lot of gaps. So what advice do you have to use this as an opportunity for long-run resiliency?
Yeah, I think there is a lot of discussion on that and a lot of thinking about what to do to build back better, the famous expression that is used, but that makes a lot of sense. And as I was mentioning during my presentation, exposing the vulnerabilities like we are exposing them, or like they are being naturally exposed. Even in the news, you hear about the subgroups that are suffering more, etc. I think that is helping in the sense of making people realize that these vulnerabilities and inequalities exist, and that we really need to address them, not just to be, it's part of future resilience. Why is everything collapsing right now? Because it wasn't very solid to start with, and that we weren't prepared, and not just from those systems point of view, but also from having access, equal access to different populations, to the service for different populations. And I would say there are lots of good recommendations. There are lots of, I think the Sophie report has good recommendations across the food system and social protection and all of that. The new GLOPAN report also focuses on improving affordability, access to availability of healthy diets, all of that, and has very good recommendations also across systems and across governance issues and all of that. So I recommend that people look at the section on recommendations in these big reports, because I think they've thought through those things. I mean, they're general and they're aspirational. So we need to actually see what will work. But
we have a question from Paul Miller that relates to that. Are there any changes going on at IFPRI relating to the sustainability of food systems, local capacity, and nutrition?
Yeah, well, there's a lot of changes going on at IFPRI, and they're not just related to the crisis, they're accompanying the crisis. It's our major change at the level of the CGIAR. IFPRI is part of a system called the CGIAR, and now we are into a new era, moving into one CGIAR, having one board, one everything. And trying to work together better. There's a lot of resources in the CGIAR, and IFPRI is mostly working on policies, but policies from a lot of different angles. We have a strong team of macro modelers, and we have a strong team of micro modelers, and then we have a team of nutritionists and economists that work together in my division. And we're all trying to react, and I think all of us have spent a year just like everybody else wondering, how can we help and what can we do given who we are? And the food systems is way up there, resilience is way up there, and also the push for more emphasis in agriculture and in production and transformation on nutrient-rich foods, as opposed to all of the previous focus on staple foods, increasing also the research and development in this area to increase the efficiency of production of nutrient-rich foods like they have done for staple cereals. So yeah, there is a lot of thinking that's ongoing, and there will be important changes.
We have another good question from Laura Caulfield. So you've talked a lot about child wasting and overweightness among adults, or obesity among adults. But what about changes in the prevalence of adult energy and insufficiency and low BMI, particularly among women of reproductive age?
Yeah. And our analysis will cover that. I mentioned that we're looking at maternal BMI changes as a result of economic shocks. So it will really, and we have more information from the data set that we use to look at this relationship between economic shocks and BMI in women. We have the DHS data, and the DHS data has a lot more data on low BMI than on overweight and obesity. I mean, the past surveys were done at times when obesity wasn't necessarily so high. So we do have this assessment in this estimation in our modeling that will be published by the end of the year.
So we have another question from Eureka, a second-year student at Tufts Friedman School. They're asking, how would governments, donors, and practitioners use the estimates from the LIST model?
Largely, I would say as an advocacy tool. It's really not something that you know. I mean, we're not even going down to the country level. They could. And I would have to, I mean, we would have to see how the team feels about going down to the country level. But for now, it really is an advocacy tool. So just making people aware of all of the impacts of the current crisis so that they focus on action right now. And they also target the problems that we identify as being more severe. And unfortunately, we do have a problem that we can't model overweight and obesity, and we can't predict it. And so that will not be well covered.
They also have a second question. That question is, how has COVID influenced women's empowerment and the quality of childcare in low and medium income countries, especially in terms of time and labor burden in response to income loss?
Yeah, this is also a whole other presentation to focus on how women are part of the vulnerable groups and the inequities that we see. And we have a couple of blogs about at IFPRI about issues related to focusing on gender and on women in social protection programs, because we know that social protection programs, when they are targeted to women, have had greater impacts on the use of the, if it is cash, for example, on the use of the cash for the diet of the household and for childcare related issues. But also we know that women, for example, along the value chain, along the supply chains are at very key steps along the way and have suffered from loss of employment. There's a lot of women in the informal sector that have lost their jobs as well, or that have had to work less hours, working in markets, working in the informal sector. So there is quite a lot of good information on gender issues in the book that IFPRI published, the book on the COVID, the book of blogs basically on COVID. There is good gender information there.
We have a question from Christina Camacho, a student here at SAIS. She's asking, what is the best way that technology and digital transformation can support addressing food security moving forward to prevent future crises?
Mm-hmm. Yeah, so part of the innovation that I was mentioning in the health sector, but also in social protection and other areas also possibly in food supply chains and all of that is related to technology. An example in India is that the government has equipped the health workers with cell phones so that they can continue to do some of their counseling, not in person, but by phone. And so they do a mix of the two. Now they've started to do some in-person home visits, but they're using the cell phones for reminders, for health visits, or for nudging with messages on behavior change, communication. So I think there is a lot going on that is not very well documented, but that we hear about, and which is a way that allows people to continue to deliver services. So this is a really good avenue for future development of these areas and to make them stronger and more effective.
So we only have about 2 minutes left. So I think we can have one last question. And that question is going to be, what is the best ways that developing countries can best protect their agri-food systems given their limited budgets and their limited capacity?
That is not a 1 minute question, sorry. I don't know how to respond to that in 1 minute, sorry.
Can I ask a question, Brendan?
Yes, go ahead.
Hopefully this is a shorter procedural question. Marie, this is Tanvi, and I was really delighted that you talked a little bit about the interaction of all four systems: health, food systems, WASH, and social protection. Since I work on WASH, how has sort of your response or your research on COVID specifically differently integrated experts from all four systems? Are you working more together now? Because I find that the WASH folks are still just working with the WASH folks.
Yes, and that's an excellent point, because you know, I feel that we are still in the same situation, and at IFPRI we don't have any WASH people. We have food safety people and things like that, but we don't have water and sanitation people. And you know, some of the results of the large trials from Hopkins actually are, I think, have kind of discouraged a little bit, which I never thought should be the message, but I have kind of had an effect of saying, and I hear that sometimes, and I say, no, you know, saying, oh, well, water and sanitation doesn't have any impact on nutrition anyway. And I'm like, no, that was not what was supposed to be learned from this. So yeah, no, I don't, I have to say that we have been incredibly good at working with people along the value chain and on food systems and on social protection. It's nothing new for us to have done that. But you are absolutely right that WASH people are not on our radar screen, and we need them. And I work on urban issues, and there's nowhere where you need them more, but it's kind of hard to establish that link. So I think Hopkins has a lot to offer.
Fix that.
Yeah, exactly.
Well, it is 1 p.m. Thank you so much, Dr. Ruel. Thank you so much, Dr. Fonzo, for being part of this webinar today. We greatly appreciate both your experience and expertise in presenting to our community. It's valuable to learn how we can prevent and build back better after the pandemic. With that, thank you for everyone for joining us today. And we're going to end today's session. Have a great afternoon, and we'll see you next time. Bye, everyone.
Thanks, Brendan. Thanks. Bye. Bye, everyone.